Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. And remember, I am a fascia-informed therapist, and I also want you to be a fascia-informed therapist so that we can create lots and lots of fascia-informed therapists in all types of settings. And today I would love to chat with you about our intuition and what's guiding us in our client sessions. Is it the clues we see, our intuition? Is it experience? Is it science? We're told evidence-based care and we follow the science and do the science. And yes, I agree with that. But remember that evidence-based care is also beyond the science. It's what the client wants, what they're looking for, their values, and our clinical experience. So let's start off by talking about the whole plan of care. In traditional education, I remember teaching students. I taught the phys rehab assessment course for a decade, and we taught the students to do a really great evaluation and then put together a plan of care. And really, what is that? It's really our best educated guess as to the actions that we're going to be able to take with that client that's going to help them reach their goals in the amount of time we have. This might include a frequency and a duration, but it's really our prediction of the outcomes we think we can achieve and how long it's going to take us to get there. Or oftentimes these days, it's unfortunately an insurance provider saying, you've got this many visits, what are you going to do? And we scramble to try and get it all done. And I'd be curious to know how often a plan of care actually works out there and is implemented, how often it's implemented and achieved exactly the way the therapist planned it out. And I recall, we'd teach our students the best we can, and man, we had a great program. We'd send students to do their clinical education, and the clinical instructors out there the students and the instructors would get frustrated because the students had this great plan of care that they meticulously created, but it would fall apart when they actually went in to see the client. And so the clinical instructors would have the students creating, well, what's your plan B? Because it was difficult for them to think on their feet at that time when they're brand spanking new out there trying to be an OT, but they're still a student. So they had them creating plan B, plan C, and D. But oftentimes they needed even plan E, because you never know when you walk in to see that client what the situation's going to be. They're already maybe been showered and dressed and ready to go, or maybe they slept poorly, or maybe they came down with another illness, or who knows, or maybe the family's in the room, or who knows. A million things can happen, right? But how do we walk in the room and decide what we're going to do? And that gets easier as we gain experience, no matter what setting you're in. We notice patterns, and sometimes that process of noticing is very conscious, and we can articulate clearly what's going on and why we're doing what we're doing, but often it's unconscious, and it is very hard to explain how we knew what to do in a situation. It's difficult to explain. How did we know it? We just did. We just knew it. Or did we? Or did we? So let's talk about intuition. And I pulled up some definitions of intuition. And intuition typically is not something that's looked favorably on in the world of healthcare. Intuition, like in my world, I've got kind of one foot in the alternative medicines and one foot in the traditional healthcare, and I lean towards traditional, but I'm always curious and reaching out into that alternative world. And we often think of intuitives like a medical intuitive. They can figure out what's wrong with you from some sort of psychic skill. But that's not what I'm talking about here. I'm talking about intuition as a knowing. So here's some definitions. Intuition is the ability to understand or know something immediately without the need for conscious reasoning or analysis. In simple terms, it's kind of a gut feeling or instinct that guides decision or insights. Then I looked up clinical intuition, the immediate experience-based understanding that guides healthcare professionals in making decisions without conscious reasoning. A form of tacit knowledge that emerges from repeated patterns, contextual awareness, and subtle cues. Subtle cues from the client, often. So it's been studied. I looked it up a little bit, and it's been studied mostly in nursing. That's where most of the resources came from. And I pulled one in particular. This is a study from 2017 called Clinical Intuition in the Nursing Process and Decision Making, a Mixed Studies Review. And this was in the Journal of Clinical Nursing. And here's the results. After a quality assessment, 16 studies were included. The analysis and synthesis resulted in 3 categories. The characteristics of intuition in the nurse's daily clinical activities included application, assertiveness, and experiences. In the relationships with patients, intuition include unique connections, mental and bodily responses, and personal qualities. And in the nursing process included support and guidance, component and clues in decision-making, and validated decisions. Their conclusion is as follows. Intuition is more than simply a gut feeling. It's a process based on knowledge and care experience and has a place beside research-based evidence. I'm going to say that again. It's a process based on knowledge and care experience and has a place beside research-based evidence. Nurses integrate both analysis and synthesis of intuition alongside objective data when making decisions. They should rely on their intuition and use this knowledge in clinical practice as a support in decision-making, which increases the quality and safety of patient care. A place beside research-based evidence. Okay, then I found another study from 2019 called The Role of Intuitive Knowledge in the Diagnostic Reasoning of Hospital Specialists. And this was a focus group-based study. So this was with physicians, which I thought was very interesting. And these were hospitals specialists that were in the Netherlands and Belgium. And they did 6 focus group discussions. And so they had, 6 key findings. The recognition of intuition. And they did, when I read through this study, they were saying that at first, many of them were saying, oh no, we can't use intuition in our practice. We have to be scientific. But as time went on, they got more comfortable saying, well, yeah, I do use my intuition. And then they started to be able to define it and explain it. Okay, terms like gut feeling, sense of alarm, and pattern recognition were used interchangeably to describe the intuitive process. Some participants viewed intuition as non-rational, while others saw it as a valid component of clinical reasoning. They said experience is a foundation. Clinical experience was identified as a crucial factor in developing reliable intuition. Participants emphasize that intuition becomes more trustworthy with increased exposure to clinical situations. Balancing intuition with analysis. While intuition was seen as valuable, specialists stressed the importance of corroborating intuitive judgments with analytical reasoning to avoid errors. Variability across specialties. The reliance on and trust in intuition varied across different medical specialties and individual practitioners. You would expect that, right? Educational implications. There was consensus that this is so interesting. There was a consensus that medical training should address the development and appropriate use of intuition. I'm going to say it again. Medical training should address the development and appropriate use of intuition, integrating it with analytical skills to enhance diagnostic accuracy. So in their conclusions, they say the study suggests incorporating discussions about intuition into medical education to better prepare specialists for real-world diagnostic challenges. I thought that was just incredible. So let's talk about experience a little bit more, and then I will talk about, well, what do you do if you don't have a lot of experience? Can you still use your intuition, or how do you build it? So one of the things that I used to do, and I have a clear memory of doing this multiple times, but one in particular, when someone who would tend to kind of poke fun at me, often behind my back, of being a voodoo queen, because I was using this thing called myofascial release in a traditional practice setting. I was managing several departments in a big hospital, and people found out that I had the skills, so they would often send the toughest clients my way. Didn't really have time to be taking a caseload, but it was fun and interesting, so I did it. But then this person came to me and said, I've got this thing in my back and it's really bugging me. I can't get rid of it. And can you help me? And I said, yeah, sure. Let's tackle it over lunchtime. So they said, okay. They started to say, well, it's right here. I'm like, don't even tell me where it is. And I had them lay down on the table, face down, they still had their clothing on, and I would run my hand over their back about an inch or two off their back, and I could run my hand over the top of them, and I would pause different places, and then I would finally go, okay, and I would press down and I would say, is it here? And they would go, how on earth did you know that? And I probably shouldn't have done that, because that probably makes me even more of a voodoo queen. But that was an educational opportunity. And I was saying, it's not some like a medical intuitive kind of thing where I'm feeling the vibes, when I really am kind of feeling the vibration. I'm feeling the vibration coming off the body. But what is that? It's warmth. There's a little inflammation there. And when there's a little inflammation and you have a crap ton of experience touching bodies, then you're going to feel that subtle change in the tissue temperature. And, maybe I just got lucky, who knows, but I felt something, and heat is energy, and it has a different feel. It has a different, if you don't feel the heat change, you can maybe feel the vibration change when you're used to feeling those subtle cues. So that's just an example. By that, let's see, where was I? That was 20 years ago. And I've been in practice for 34 years now. So, I had developed, I never did myofascial full time until the last 8 years, but I did it enough to develop those kinds of skills. The other thing I developed more so after I really started learning about posture, when I started reading Move Your DNA and learning about Katie Bowman and reading her Movement Matters. I think I read that thing 5 or 6 times, and I still refer to it often. I started learning about posture and looking at that more in myself and my clients and my friends and my family, and really gaining skills at looking at people and observing. And then the more I looked integrated posture into my client session, the more I started just noticing. And once you can't turn it off when you're out there looking at just people in the world. Airports are a great place to do that. But I remember one time I went home to see my dad, who's about 4 hours away, and he's still in the area where I grew up. And one of my closest friends is still there, and I stopped to have lunch with her in this little tiny town that we grew up near and she lives in now. And we're sitting at this little lunch counter in this tiny town, and we're eating and talking, and just kind of off the cuff, I was noticing the owner of the little cafe sort of running around and getting things done. And just off the cuff, I just sort of said, kind of thinking out loud, boy, I bet his back hurts. And my friend looked up to see who I was talking about, and she zoned in on him. And right at the moment that she zoned in on him, he put his hands, that thing that we do, put the hands on the low back, kind of about the belt line, and then just leaned back and stretched and made this face like, oh, geesh. And she looked at me and she's like, how did you know that? That's weird. And it wasn't this weird psychic ability. It was me seeing patterns. It was me seeing patterns that I was seeing over and over again in my clients, things that I had learned about and put together, and could now very intuitively recognize in other people and make reliable predictions. And we probably know this a lot as occupational therapy practitioners, or practitioners of all kinds, begin to see patterns. But do we refer to it as our intuition? Well, I think we absolutely can do that. Okay, so something else I wanted to include in this and developing your intuition is thinking about the sensory input that we've got coming in when we are trying to zone in on a client, whether we're listening to what they're saying to us or whether we're putting our hands on them and feeling the tissues. And when I was first really trying to get good, because I was trying to get good the whole time, because I care very much about, I'm a high caring, high empath person, so I'm always trying to get better at my craft. But when I started going into my practice and I'm charging people cash for what I'm doing, man, I was just doubling down on wanting to do the very best possible I could for my clients. And I remember oftentimes when I had my hands on people, I would close my eyes and get really quiet. And I was doing that because I wanted to block out the sensations that were going on so that I could really feel what was happening under my hands. And I know that I do the same thing, like when I'm driving and I don't exactly know where I'm going, or I'm looking for a location, I'm trying to follow the GPS and listen to what it's telling me, and I'm looking for a sign of what I'm going, I will turn the radio off because I want to minimize the sensory input coming in. And yes, as I get older, I need to do that more. I will shut the radio off if I am in high traffic, especially in an area that I don't know where I am, if I'm in a new city or something. So it's the same thing. We try to minimize that external input in order to increase the feeling of one sensation. And for me, it was my hands. And I don't need to do that as much anymore because I can feel things very, very quickly. And I'm recording this down in Arizona again, and my friend that I was staying with took a little tumble and hurt herself. And so I've been working on her a little bit while I'm down here. And I was working on a very old area with, she would not like that I said that. She is in her 70s. She won't mind me saying that. but I was working on an old scar is what I meant to say. And I was working around that area and I found this teeny little tiny bump and I'm like, whoa, this is probably really tender, isn't it? And she said, oh my gosh, yes, absolutely. How did you know that? Well, again, it's just my hands are very used to feeling the different textures in people's tissues. And it's easy for me to find. And I'm not always right that a little spot that I find or a big spot feels tender, but often it does because I've developed that pattern of recognition and can make conclusions. But again, you always have to validate your conclusions. So I pulled up some information from the big book. Let me see if I can find the name of it really quick. I don't know why I can't remember the name right now. Here it is. Fascia, the tensional network of the human body. And Robert Schleep is one of the primary editors on that. But this was from that book, and the chapter was written by Thomas Myers. And he's talking about what we're looking for, the clues that we're looking for when we're doing manual therapies. The information a practitioner needs to gather will vary according to the therapeutic approach and may include range of motion, the feel of joint play or end feel. We know that as occupational therapy practitioners. Standing tone, relative weakness or tight muscles, the amount of induration, edema, or fibrosis in the soft tissue, the feel, density, mobility, and ability of the adjacent fascial layers to glide, the identification of regions where reflex activity is operating, noises and palpable clicks in the tissues, the quality of perceived tissue vitality. Is it flaccid? Is it toned? Variations in the temperature over regions of the body. To maximize the information gathered from palpation, it's helpful to minimize the amount of noise in the system. A conscious effort to reduce excess tension in the therapist is fundamental to refine palpation skills to improve the signal-to-noise ratio in his or her own system and get an accurate reading on the client. So yes, I think that is very important to, he's also adding, I said, I close my eyes, he's saying relax your body. And I totally agree with that. And I often teach that to people that I'm working with when I'm teaching them how to do a skill, is how to relax and take care of their own body. So this kind of led into the intuition piece on where to work. And Myers talks about that as well. And I remember going to many workshops and hearing, find the pain, look elsewhere for the cause. And I do agree that we have to do that. And Myers gives it a little more specificity when he talks about it here. He says, first, stop chasing the pain. Well, yes, we do have to stop always working exactly where the pain is. He said, manual therapists must look globally, act locally, then act globally to integrate our local remedies to the person's entire structure. And then he has I really love the way that he speaks and shares information. He says, the big shots, in quotes, in human structure are rarely felt by the client as painful. The important primary areas are usually numb for the client. And it's the job of the manual therapist to be able to spot the cause rather than caught messing around with the effects. And here's what I want to add to that, because I agree to a point. What I have found out over time, because I can look at a client and look at their posture and hear about their history and listen to their symptoms, and I actually have them draw their symptoms for me too. I can listen to all that and I can think, okay, I bet this is where the problem is, but clients want to be touched where they hurt. And they don't always understand that global perspective. And it may take time for them to really understand and appreciate that. And I do work hard to help my clients understand that. But if we're not touching them where the pain is, at first anyway, then we risk them not returning for more care, so we can really get at that bigger problem. We got to get that pain down, and that often happens from touching them where it hurts, and then go to those other big shot areas that Myers is talking about, because they are most definitely there, and there's often more than one. But it's also true that sometimes the problem is right where the pain is. And that is also something that you start to learn over time and develop intuition about. There's also a book out there that was, I think, 2005. Malcolm Gladwell wrote Blink, and I remember reading that back in the early 2000s, somewhere in there. And he talks about the ability of our brains to gather clues extremely quickly, and that this intuition process is extremely powerful, but it's not perfect. It's a sophisticated form of pattern recognition that occurs rapidly and often outside of conscious awareness. And it's happening to us all the time. We are continually making judgments and making decisions using that intuitive process. And we don't often pay a lot of attention to it, but we are using it. And we don't pay a lot of attention to developing it, being aware of it and developing it. I would say the average person, maybe as clinicians, we are doing that a little bit more. He also says that intuition is only reliable when it's built on deep, meaningful experience. And that those gut feelings are not random. They're based on a vast internal library of past encounters, decisions, and feedback loops. This is why expert intuition is often more accurate than lengthy analysis by a novice. It's not magic. It's the result of countless hours of exposure and refined pattern recognition. Okay, so Gladwell also says that experience must be meaningful and diverse, and we have to pay attention to it. That's what he was talking about with the feedback loops. We have to use our intuition, apply it, see what happened, and then keep learning from that, learning and applying. So what do we do? What do we do if we don't have a lot of experience? We go back to the clues. We gather a hearty amount of good data, or in other words, do a very thorough evaluation and get our clues from there. But what guides that evaluation? Science and theory is where we start. Getting that good, solid foundational education of what is important to gather. And I remember teaching the students, this was kind of an interesting leap for them, because in their minds, the more information that I gather, the better. And so they would just start throwing assessments when I'm asking them, okay, here's your case. What are you gonna assess? They would just start throwing out all these different assessments and things they were gonna do. And I'm like, nope. Okay, if you do this, what are you gonna do with it? How is it gonna help you better understand the client's problem and how to help them reach their goals? You don't wanna waste time getting data that's not useful. So taking the time to think about that. So thinking about, how does the history of the client provide their clues? What injuries, what illnesses do they have? And what are the possible symptoms that arose from what happened in their history? The posture assessment gives us tons of clues. The client's symptoms that they're telling you and explaining to you gives you tons of clues. How they feel the pain in their body, or how they feel the symptoms in their body. And then your hands-on assessment provides you clues. And over time, you will start seeing those patterns. And I think I talked about this earlier, but I would tell the students, you have to start making assumptions. You do your chart review, you make assumptions about who this person is and what you're going to need to do before you even go to the room. You're making a story in your head, making an assumption of what you have to do. And then you get into the room and you have to validate those assumptions. Every assumption you make must be checked. And then when you do walk in the room, you're going to learn to start gathering clues before you even say hello and introduce yourself as their occupational therapy practitioner. So you have to, and that will come slowly over time. And I would we had conversations about what are all the things that you can see when you walk in the room. You can see, do they have glasses? Are they sitting in a wheelchair? Are they slumped to one side? Is there any food on the side table or drinks? What are they able to do? You can gather so much information. As Malcolm Gladwell explains, it's not just experience, but paying attention to our experiences that helps us build strong intuition. So we have to have experience, we need science, we need theory, and we need attention to what's going on. And then slowly that attention over time helps us to build this experience that we call intuition. And I think one of the most important pieces of that is attention. And I remember in a lot of the continuing ed that I went to that we were told to turn off what we know and just feel and experience. And I think that is a valuable part when you've got your hands on somebody, to just feel what's going on and close things down a little bit, but do not let go of what you know as a practitioner, your clinical reasoning, the science, the theory. It's all an important piece to guiding you to those places to work with a client. And it's not just what to do on their body, it's also what homework to give them, where to direct them in helping them change their posture, their movement practices, their habits, their flow of life, how to integrate new habits into their current routines and roles. All that is important together. So I also want to talk a little bit more about attention itself, but I think I'm going to make that next week because I found a really cool study on how attention is important for us as practitioners, but our attention also makes a big difference in the client's experience as well. So we'll save that for next time. So thank you so much for listening. I appreciate all of you so very much. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.